Regional Institute of Medical Sciences RIMS IMPHAL Sinduna Humbudra Tret Suba Republic de Thouram Hospital Ashimakki Administration Block ta HOUKHIBA NUMITTA Pangthokkhre Director Professor G Sunil Kumar Sarmana Machu Ahumgi National Flag adu National Anthem gi tanthaga loina na chingkhat ki Thouram aduda RIMS ki Administrator Faculty Staff Student RIMS Community gi Member sing saruk yaki
will be operational in next 5 to 6 months as promised by and once we have this critical care block which is 150 bedded, we'll be catering one of the biggest critical care service not only in the state but in the entire Northeast. Also we are having a much needed ETP STP plan which was mandatory for the hospital to run, but for some reason we could not, but still we are hopeful that should be done in next 3 to 6 months. Beyond that, we have a dream project of redevelopment of RIMS IMPHAL in 3 phases. It may take about 10 years, but the phase 1 is on the last stage of its approval, means already we have started paper, EOI and the other requirements. And once it is done, we will be seeing some good development, including the first phase of 750 bedded hospital block. They will replace the existing the old hospital block. Beyond that, we have tried to improve the infrastructure inside the hostels facilities. Also, we have tried to improve the roads. Only thing is, we have to dig up the roads for the ETP, the STP completion. So I think I apologize to all the staffs, including the students, who are facing lots of tough time crossing that. And we have been ensured that this middle road going to the dental college should be open in the next few days. We are trying hard on that. Once that is done, I think we are going to blacktop the whole campus so that we don't have any dust inside this campus. Also, just to mention on the recent development, we had opened the gym facility, which was appreciated by many, and I have checked the attendance. 2 days back there was an entry of 50, the gym enthusiasts. So the 50 is a good number to start. I request everyone to use the facility so that we become all better in health and also in the mental side. Also, we plan to have the first and second floor to be utilized as the special blocks. Maybe for the faculties, we will have a separate cardio center for all the staffs, and also for the use of the floor for the yoga is now being mandated by the NMC and other as